1, 2, 3, 4. Tell me your name, okay? Oh. What is your last name? How old are you? 5. Clap your hands, clap your hands. At the age of 2, we were told that the child had signs of autism spectrum disorder, and we did the appropriate tests. At that time, there were only signs of the autism spectrum. At the age of 3, the diagnosis of the autism spectrum was already confirmed. He did not respond to his name, could not point his finger, could not maintain eye contact, lived in his own world, ran in one trajectory, spun around, was not interested in anyone or anything, did not play with children. Therefore, there were many signs. It is quite difficult for a parent to accept this diagnosis. Like other parents, I thought that nothing was wrong with the child. I thought that the doctor was not competent. And started looking for other doctors in the hope that I would get a different answer. I thought that the child did not have autism, but I still went to therapy. It did not hurt anything. The step he took was my achievement. I realized that I had to work as hard as possible. The child will always be autistic, a different person, but we will teach him how to be independent and get used to living with ordinary people. We had minimal results with prior therapies. All this took a very long time and was difficult for both the child and the mother. Mrs. Katuna told me that there is a doctor, Tengiz Tkebuchava, who has an innovative discovery for patients on the autism spectrum, with no accompanying contraindications. I found it difficult to believe about the contraindications, but I searched for many articles and decided to try it. I am very grateful that in our case we have good results. The child has developed a startle reflex, fear, improved eye contact, responds to his name, and looks you in the eyes. Tell me, what is this? Orange. And this? Egg. Do you want an egg? Egg. Give me. Take. We performed 3 procedures. The result was felt on the first day. When leaving the clinic, the child said 2-word sentences not grammatically correct. Previously, he did not pay attention to what was happening around him if he was not interested. He raised his head and looked at people. I hope that in years to come, the child will be completely independent and will become an athlete. He loves to swim. He will be able to form his own opinion, walk independently in the street, and tell the difference between a dangerous and safe environment. If your child is different, it is not a shame. We do not have the proper education on how to behave. If we manage this process correctly, our children will make many more discoveries in the world.
There are many problems in the field of neurodegenerative diseases, and the number of patients is growing every year. I have numerous patients here in Batumi. Previously, it was believed that autism was caused by genetic factors. However, more and more professionals now are writing that the condition is also caused by bacteria, viruses, and stress, as well as leaky gut syndrome, through which bacteria penetrate and affects the brain. This explains why development and nutrition of children up to 2 years of age is normal. After the 2-year mark, parents notice various symptoms in their child, take him to the doctor, and by the age of 3, the child is diagnosed with autism spectrum disorder. If we consider stem cells, they self-reproduce and turn into various types of tissue, including nerves. There are many types of stem cells, and it is necessary to know which treatment to choose. Regenerative medicines use not only stem cells, but also nanotechnology, such as exosomes and more. In our clinic, we carefully study the anamnesis and select an individualized treatment, focusing on the characteristics of each patient to achieve maximum efficacy. I am a supporter of combined approach. I use a comprehensive approach to create a synergy of regenerative agents and the fastest and safest effect. Our clinic shows very good results. We have more than 91% success in the treatment of autism compared to others. When I go to conferences, I see that our results are better as well. These advantages give us hope that with the right approach, we can continue improving the outcomes for patients and offering them a better quality of life.